Hello, everyone. Welcome to today's webinar. My name is Roshni Kurian, and I am the Education Coordinator here at the Canadian Association of Social Workers. Thank you so much for joining us here today for a very special webinar titled Social Work and Primary Care in Canada, a Vision for the Path Forward. We are so lucky to welcome the group who led Team Social Work for Team Primary Care, which is an interprofessional initiative of the Foundation for Advancing Family Medicine. This team has provided exceptional social work leadership by developing a 6-module e-learning program called Social Work in Primary Care and CASW's report, Social Work and Primary Care, a Vision for a Path Forward, both of which can be found under the Resource tab widget. Before we begin with our webinar today, I would first like to acknowledge that the CASW is situated on the unceded and unsurrendered territories of the Algonquin and Anishinaabe peoples. Our work is carried out across the traditional lands of many nations and peoples across Turtle Island, as we are a national organization. CSW recognizes our complicity in settler colonial violence, and we honor our commitments to truth and repairing relationships. We welcome you all to take a moment to reflect on the territories that you are tuning in from and the many nations and peoples who have cared for our lands. Before introducing our moderator for the day, I will just quickly go through some housekeeping formalities. Today's event will be 60 minutes, and towards the end of the session, we will address questions from the audience. Each of the widgets on your screen are adjustable and movable in size, so you can range your screen to suit your preferences. Live closed captioning in English and French is available on the platform under the media player widget. And I encourage you to type your questions in the Q&A box at any time, and we will do our best to address them at the end of the session. The recording of this event will be available in 24 hours using the link that you signed up with. And a certificate of attendance will be emailed to you at the end of the session, or you can download it directly from the platform. And lastly, please be sure to fill out the survey that will appear at the end of the session as well. Today's webinar will examine the state of social work in primary healthcare in Canada and discuss CASW's report outlining a vision for social work practice in primary healthcare. I will now introduce our moderator for the session. Keith Adamson is an associate professor in the Factor in Inventage Faculty of Social Work at the University of Toronto. Keith holds more than 20 years of progressive senior management experience in clinical, management, and professional practice leadership roles in healthcare. Thank you so much, Keith, for moderating today's panel and for introducing the rest of our panelists.
Thank you for the introduction, Roshni. Good afternoon, everyone. Bonjour tout le monde. I want to welcome everyone. My name is Keith Adamson, and I am so pleased to be the moderator for this afternoon's conversation and to have you with us today for this very important conversation on the role of social work in primary care, especially within the Canadian context. But just before we start, I want to know who's with us and where are you joining us from? So if you could just put in the chat, and I'll go to the chat, see where people are joining us from. Take a minute or two just to let us know where you're joining us from. Don't be shy. Oh, I love it. I love it. It's coming in. I was getting worried there for a minute. Rural Manitoba, Nova Scotia, PEI. Oh, wow. Winnipeg, Windsor, St. John's, Newfoundland, North Bay. Wow, this is amazing. Walkerton, Ontario, Saskatoon. Oh, wow. Vancouver, Lloydminster. I'm seeing so many. Thank you so much. And if I didn't call it out, forgive me. It's going by really quickly on my group chat. But welcome everyone to this conversation. It is so wonderful to have everyone here from across the country, connecting social workers across the country as well. We have with us today three engaging practitioners and thought leaders on the topic of social work in primary care. We have Rochelle Ashcroft, who is an associate professor at the Factor in Montage Faculty of Social Work. Rochelle is also a colleague of mine and cross-appointed to the Department of Family and Community Medicine at the Faculty of Medicine at the University of University of Toronto, with an expertise in interprofessional primary health care. We are also joined by Louis-François Dallaire, who is from the Centre intégré universitaire en santé et de services sociaux de la capitale nationale, is a social worker and an educator in primary healthcare in Quebec, and chairs the College of Family Physicians of Canada's Health Professional Educators in Family Medicine Group. And we also have Casey Laviolette from Vancouver Coastal Health. Casey is a social worker with extensive experience in primary health care and is a past board member of the BC Association of Social Workers. He is a skilled leader in crisis intervention, research, community development, community outreach, and case management. So welcome to all of you. Thank you for joining us. As many of you know, primary care in Canada is undergoing significant transformation, from increasing patient complexity to workforce shortages and the growing emphasis on team-based care. So the system is evolving, and with it, the roles of those who support the system are also evolving. Social workers have long played a vital role in addressing social determinants of health, supporting mental health and wellness, helping individuals and families navigate complex systems. But as primary care continues to shift, so too must our vision on how social work is integrated and valued within this context. So today's webinar is an opportunity for us to come together as a community to explore both the current landscape and the vision for the future. We'll look at how social work is contributing to primary care today and how we can strengthen that role moving forward, ensuring that care is not only effective, but also socially responsive and equitable. So we're very fortunate to have a group of thoughtful speakers, panelists who bring a wealth of experience and insight. And I encourage you to fully engage as audience members. Think of really interesting questions that we could have perhaps the panelists speak to near the end if we have time. And I look forward to having a good conversation about a collective vision for the future of social work and primary care. So thank you for being here, and let's get started. So Dr. Rochelle, you're going to kind of give us a national perspective to kind of look at what is primary care. You're going to give us a little foundational centering on what primary care is.
Yeah, thanks very much, Keith. I'm so happy to be here. I'm very excited about this topic. It means a lot. And we know that there is great work that has already been done from social workers in primary care. And as Keith has mentioned, it is a very exciting time with the focus on expanding teams. But I'm going to get started by just talking a little bit about some of the foundations that we need to think about from an academic perspective, just to ground our conversation. In terms of primary care itself refers to one part of the healthcare system that's often referred to as the place of first contact. It often involves family physicians, nurse practitioners, and potentially like a broad range of health and mental health providers, including social workers. Primary care is intended to be the place in the healthcare system where people can have access to community-based, comprehensive care over time from people that they trust. So I think of myself when I was younger, I had this family physician that I saw for 12 years in my kind of formative years. And now that's not as longitudinal, but that longitudinal relationship is really important in primary care. It's meant to be the place that coordinates care and helps with system navigation across other parts of the system. So it really is meant to be a core hub. And what's particularly important, like I mentioned, is that the relationships that people develop with their healthcare providers, often over many, many years, are considered an essential component of primary healthcare, which is different than like hospital care or acute care where it's more episodic. So it's meant to be long-term. In Canada, each province and territory manages and delivers their own healthcare services. So part of the reason why that is that each province and territory can make decisions and establish primary care services in a way that aligns with the needs of their communities and populations. But it also then results with what we're seeing with such vast variations across provinces and territories. Some that are great variations that really align with the needs of communities, and some of the variations and some of the gaps that we're seeing currently that we'll talk about a little bit later on. Right now, across Canada, though, there is currently a widespread focus on building interprofessional and intersectoral teams to improve access and collaboration. There is no one model of primary care. And because of that, we are seeing so many different ways of working in primary care teams, which is really, really important for the experiences that we're hearing from social workers. So, for example, some teams are co-located where everybody who's working as part of that primary care practice are under one roof. There's primary care practices and teams that are across multiple sites, across multiple geographies, and sometimes people are collaborating remotely from a distance, sometimes a great distance.
So at this point, we'd like to know, do you work in primary care? So for all those social workers listening in, this is a poll. So do you work in primary care? Just take a few minutes to answer, a few seconds to answer that. Oh, it's coming in. So we have, it looks like there's quite a few of us who work in primary care who are listening today. And then there's some who are curious about learning more. So about 65% of us work in primary care, and about 34% of us are wanting to learn more about primary care. That's fantastic. Rochelle, you spoke about the fact that primary care is happening throughout Canada, but there's variations on what it looks like. And so I think having more regional dialogue and really showcasing a variety of viewpoints really can help us to create a richer, more inclusive narrative, I think, that resonates nationally. And I think that's what we're trying to do today by having this conversation. And so today we have some viewpoints that are not necessarily only limited to what you'll hear today, but I think it demonstrates the diversity of what's happening across Canada. And at the same time, I think it will also help kind of foster conversations around understanding and being more empathetic with respect to the nuance of our collective stories across Canada as well. So I want to invite Louis-François to speak a little bit to what primary care looks like, I guess, in Quebec.
Yes, thank you, Keith. It's a pleasure to be here with all of you today, and quite exciting to see so many of you showing up at our webinar. So first of all, I feel that I should, almost issue a warning, because I've been working with family docs for the last 21 years, and they sort of rub on you, which means that I tend to use the word patients instead of people or clients. And I know that some social workers find that irritating. So I'm going to do my best today with you. So do I go ahead with my slide, Keith? Is that it, or is that just
go ahead.
Okay. So
Rochelle, are you advancing the slide?
I'm not supposed to go first.
Oh, okay. So sorry, we'll get Casey actually. Casey.
Great, thanks.
I think you're.
Can we go to, there we go. Thanks everyone. Sorry to interrupt you, Louis-Francois. So hi everybody, my name is Casey Laviolette, and I'm coming to you from the traditional unceded territory of the Shishal Nation in on the Sunshine Coast in BC. And I work for Vancouver Coastal Health, which is a health authority here. So in BC, primary care networks are explicitly a partnership between divisions of family practice, so local associations of family physicians and nurse practitioners, the health authorities, and First Nations. And so they are co-designed and co-implemented with this sort of tripartite model. And so while physicians early on in the 2010s identified that social workers should be a key component of primary care networks, at the local level, it doesn't always work out that way. Health authorities may have different priorities, First Nations may have different priorities, and the practice of social work might look different in different communities. It could be more of a focus on mental health, for instance, or it could be more of a focus on working with older adults. Next slide, please. So because the funding, of course, comes from the Ministry of Health, and there is a large focus from the ministry on attachment. As we all know, there's a huge problem in Canada with people who don't have a family doctor, a family or a nurse practitioner. The University of British Columbia last year did some research and came up with some evidence to demonstrate the value that social workers bring to primary care practice, in particular, being able to relieve some workload from physicians and nurse practitioners, which might and hopefully lead to more attachment of vulnerable patients. So this is from the University of British Columbia's release on what a social work primary care visit might look like. So I've put a link down here at the bottom of the slide if you want to take a closer look at it. Next slide, please. So I live and practice in Seashelt and Gibsons on the Sunshine Coast, and in a rural context in BC, as I imagine elsewhere in Canada, social work in primary care tends to look different. We do have a much broader scope of practice. We do tend to practice as generalists, and a lot of our focus might be on reducing isolation, increasing access to transportation, working with those vulnerable adults who are not able to come into a primary care clinic, for instance. We might cover multiple towns or clinics, and because of this explicit and integral partnership with First Nations communities, our practice does tend to address and work directly with First Nations communities, and we, of course, like all social workers, work from an anti-colonial approach and have a practice steeped in reconciliation.
Okay, thank you so much, Casey. And now we will have Louis-Francois.
We'll be talking about patients instead of talking about persons. Okay, so well, actually, in the province of Quebec, social workers have been a part of primary care for quite a few decades by now. I would say that our role in primary care has expanded considerably throughout the years and throughout the reforms, because reforms are something that the Quebec government is especially fond of. more on that later. But the good thing is that social workers have taken on a gradually larger and more important role in primary care. So I wanted to go over the basic outlines of the primary care organization of services in Quebec, because there are many wonderful community-based initiatives in primary care in Quebec and in other provinces as well, I'm sure. But 85% of the Quebec primary care social workers are employed by the public health system. So I'm going to focus on that. So as you can tell on this slide, there are three major organizations or institutions that deliver public primary care: the CLCs, which are, your basic indoor to health and social services, and who do also provide direct services to the population. And then you have the GMFs, which are the Groupe de Médecine de Famille, so family doctors groups. By contrast, GMFs are basically a medical clinic providing comprehensive primary care services, and the teams include the variety of health professionals. I won't repeat what Rachel said earlier on, but we do have the staff of, family physicians and social workers and various nurses and so on. And then you have the GMFUs, which are the GMF Universitaire. And this is where I work. And a GMFU is a university-affiliated GMF that also serves as a teaching site for future family physicians during their 2-year residency. So professionals working in GMFUs typically deliver clinical services to the patients, but they also contribute to the professional development of family medicine residents. So social workers, such as myself, are especially likely to be involved in the teaching to the residents. And so, of course, I'm not going to be teaching about, the rotary cuff tendonitis or the treatment of urinary tract infection. But I do teach about stuff like mental health issues, doctor-patient relationship, communication skills, and of course, interprofessional collaboration. So this is actually an exciting part of my daily job. And I truly believe that this is, a good showcase for our social work expertise. And we all try to be good ambassadors when we're social workers in GMFUs. And as far as my clinical role, well, I think that diversity is the key element here. I do case management, crisis intervention, grief counseling, system navigation, a bit of advocacy. Once again, diversity is the key word. And I sometimes also have to, how should I put this delicately, facilitate access to the medical services for our patients, because I am sometimes in a better position than the patients themselves to organize medical services. So I do my best when it comes to that. And I would conclude by saying that Rochelle earlier on mentioned that social workers are expert generalists. And I believe that this is one of the many reasons why social workers and family physicians can be such a natural interprofessional fit. Our professions both come from a generalist perspective. We deal with issues and conditions that can vary to the extreme, and we both need to demonstrate constant adaptation skills. So I think that there is a natural fit between family physicians and social workers, as far as I'm concerned.
Thank you, Louis-François. So we've had the British Columbia perspective, we've had the Quebec perspective. Let's have the Ontario perspective.
Yeah, thanks, Keith. I just want to pick up with what Louis-François was just mentioning, that there is a really good fit between social work and primary care. And part of the reason why is social work's values is social justice and equity, the focus on holistic health, and just that broad range of clinical expertise that we bring really align well with primary care. And we are seeing that when primary care integrates social work into these teams or whatever the configurations are, that it's improving the comprehensiveness of teams, it's improving the function of teams, like how teams operate in the cohesiveness. It expands access. And so I'm going to share what's happening a little bit in Ontario from the perspective of a researcher. So in Ontario, we do have the Primary Care Health Act is legislation that was passed and just came out in May 2025. So that's quite exciting because we do have legislation right now that's really focusing on improving access. And the reason and the how is kind of what Keith was mentioning earlier, was the challenges that we're seeing with access, the challenges with human resources, all of the robust needs for mental health care and social services to respond to the social terms of health, particularly with the acceleration that emerged during the pandemic. And the image that you see on screen actually points to Ontario's Primary Care Action Plan that's underway. So in Ontario, there is, you might have heard, like there's all these financial investments that are really being aimed at not only building new interprofessional teams, but trying to improve even collaboration across sectors. So that's what we're seeing in Ontario. There are several team-based models of primary care in Ontario. Community health centers are one model that were established in the 1970s that serve priority populations. While the first wave of family health teams emerged in 2005, there's also Indigenous primary healthcare organizations developed by the community and for the community, and as well nurse practitioner-led clinics. And why this is important is just to illustrate, even within one province, there's even multiple models. And the reason why is that each model is really aimed at serving different types of needs of communities. Across all of the models in Ontario, we know that there's approximately 740 social work designated positions in Ontario. However, we also know that social workers are working under a range of different titles in Ontario in primary care, such as mental health counselors, registered psychotherapists, and there's a number of different types of titles and roles that social workers are working under. So it's actually really difficult for us to ascertain the exact number of social workers in Ontario working in primary care, but we know that we have robust numbers and are the third largest provider group in primary care, following all the physicians, all the nurses. And we've done quite a bit of research to understand the needs and priorities of social workers in Ontario's primary care. So I'm just going to share a little bit of some of the research that we have done. In Ontario, results from a survey show us that social workers in primary care are seeing patients across all ages, with the emphasis of practice being on adults. In focus groups, social workers told us that patient needs in primary care are quite broad and complex, and that there's an emphasis on the social terms of health. So that term that Louis-Francois had mentioned, that expert generalist term, really does apply to what we are hearing from social workers in Ontario. And you'll see those yellow boxes on the side. Those are quotes directly from social workers who participated in our focus groups. In our survey, social workers were asked to estimate how frequently their social work practice focused on these different practice areas listed in this table. And so the area that we've highlighted in yellow is just there to illustrate the most frequent practice areas. And mental health, not surprising to all of us who are social workers, was reported as the main practice area by everybody who responded. Social terms of health were high, as noted by the financial stressors, social assistance, housing insecurity, as was the area of addictions and substance use. So there are like robust needs that that we're seeing in primary care that social workers are contributing to and assisting with. And then two last slides just to illustrate what that's looking like for social work in primary care in Ontario specifically, although what we've learned, some of this really does apply even across other geographical sectors. We are seeing in terms of access and wait times, we asked about just typical wait times for urgent and non-urgent referrals. So you'll see here on the left, the blue are indicated as like that blue bars, all the urgent reasons why somebody would make an appointment. and that yellow is non-urgent appointments. So when it comes to wait times for urgent referrals, 15% of social workers said that they're able to accommodate same-day appointments, and another 37% indicated a waiting time of 1 week. So people are really committed to access and are there in their communities and are kind of like this main source that we're seeing patients and people accessing services. And for some communities who, prior to some of these teams being established, having access to publicly funded social work services in a timely manner has been insurmountable for some of these communities, particularly some of the smaller rural communities that maybe previously didn't have any publicly funded social work services. And then lastly, just want to highlight, and hopefully you can see those different categories on here. In our survey, it really demonstrates how social workers are providing leadership to their teams in a variety of ways, often being done informally. So it's really important for us to maybe articulate more what's being done in teams, because we are seeing that social workers in primary care are a key source of leadership in these teams. First, social workers have been really fundamental in shaping how teams operate, providing consultation to the range of different medical and other healthcare providers, and leading team case consultations. So we know that the capacity of teams are enhanced by having somebody like a social worker who brings the expertise in mental health, social terms of health into that team. And then third, social workers also have provided leadership by representing primary care on sometimes regional committees where possible. And for the new teams that are emerging in Ontario, we're really encouraging them to build leadership into that social work role. So making it less implicit and informal, but actually making it more formal and explicit.
Mm. Thank you, Rochelle. I have a quick question for you guys. Just really quickly, you've kind of given us this description of what it looks like, what primary care and the role of social work looks like within your own contexts. What are you excited about currently with respect to social work, and what makes you hopeful for the future of what social work could contribute? If you guys could just give maybe a 1 or 2 minute reflection on that.
Okay, well, I can go first. Some time ago, one of the doctors that I work with came to me because I had asked him to see one of his patients that I was seeing as a social worker on a regular basis, and this patient needed, a leave of absence from work. And so this doctor's reply was, well, yeah, I'm glad to do it, but, come to think of it, you would be in a much better position to sign this piece of paper. I haven't seen this guy in 2 years, and you've seen him every week for the last couple of months. So I know you're not allowed to as a social worker in Quebec, but, you should be allowed to do that. And I could only nod in agreement, because I know that in some provinces, some social workers are allowed to issue sick notes, but we can't do that in Quebec. And one of the reasons is that insurance companies and employers won't accept these notes if they don't feature a diagnosis, which is another thing that we cannot do in Quebec. So this is not what excites me about the future, but what excites me about the future is that things like these are an invitation to think outside of the box. And, to talk about shared responsibilities in the interdisciplinary team. And this conversation is starting to happen in Quebec because, there are just not enough doctors to do all that stuff, right?
Right.
And I don't know about you, but I trust my professional judgment enough to know when a patient that I've been seeing for the last 2 months does need time off from work. So there would be, normative and even legal issues surrounding this, which is why we're going to need some allies to do that here in Quebec. But I'm excited that this conversation is finally starting to happen. And the point is not to replace the doctors. The point is not to start pretending that we have the same field of expertise as doctors do, but just to be more open about shared responsibilities within the primary care team. Because there is a reform of primary care currently brewing here in the province of Quebec, and the efficient use of the interdisciplinary team is one of the key elements of that reform. So we are going to have to start thinking outside of the box.
So really looking at what scope of practice looks like as we move forward.
Sorry,
Michelle, Casey, did you want to add anything, or?
I just to add to what Louis Francois was saying in terms of scope of practice. I think for like a lot of us, after we graduated with our MSWs or whatever our degree happens to be, we're feeling really jazzed. We're thinking, I'm going to get out there. I'm going to work in this sort of anti-oppressive model of practice and really make a difference in people's lives. And often we become constrained by the limitations of the workplace and have to navigate that. But what I've found in primary care is that it's so open for interpretation, and it really allows the social worker to practice in this more fulsome way with a social justice angle, and be able to demonstrate that to the rest of the care team, right? So you're really introducing social work to clinicians, family physicians, or practitioners who may have never worked alongside social work, and you're able to really work to that full scope that I had always wanted to work within, without the constraints of only people with certain diagnosis or only for this time limited period. So I find it really exciting, and I hope that it's something that can kind of bleed over into the rest of the healthcare system eventually.
I have like one question that I want to ask everyone, if that's okay, from the chat. It's a question that says, how is social work service in primary care integrated with mental health services? So do primary care social workers offer more episodic care, and mental health service offers more specialization? That's a question that I'm throwing out for all of you. It was in the chat, figured we'd.
Well, here in the Quebec system, we're more and more involved in what is called step care, in the sense that usually it starts with the primary care teams, and we have to determine if we can do some short-term social interventions or social psychological interventions, and then if that is not sufficient, then we move on to more specialized services.
Yeah, maybe I'll add. Thanks, Keith. Maybe I'll just add a couple things. First, I did mention that there's so many variations that exist not only across Ontario, but across, the different jurisdictions. And so we're seeing that there are some teams that have really done a great job of integrating mental health services, including social workers, within their team, and that they're collaborating with some of the more specialized services. But I would say that those tend to be the anomalies, that we haven't yet done that well in terms of collaborating and figuring out like who's doing what in somebody's mental health journey, which could be quite like over a long period of time, and maybe requiring a range of different needs. And so in terms of future, there's a couple of things that I'm excited about, but there's one thing that we definitely need more guidance on. And it's just, some kind of guidelines and guidance specifically around this question. Because right now, each team is almost making decisions based on what they're seeing for themselves and, drawing from the literature, but we don't have really good comprehensive guidelines on how to do that. We don't even have good comprehensive guidelines provincial for each province or nationally on just the scope of practice for social work and primary care. So questions that I get asked frequently, and people contact me frequently, is, what should be the recommended number of clients or patients that a social worker sees per day, per week, or per month? And there's such vast variation of what is taking place. So just having some kind of more cohesive range of guidelines would be helpful, not only for social workers, but also for the practices who are establishing these services. And then maybe lastly, I'll say in terms of momentum, and what's bringing me enthusiasm is just this momentum that we're seeing. And to build off what Louis-Francois was saying, many of us have been working in this area for a very, very, very long time. And now just seeing that there's kind of like recognition at the systems level of the need to be more cohesive, that we need to provide guidelines, better coordination of social work provincially and nationally, and to bring together, communities of practice. Now that we're seeing that there is a system level commitment, that that's very exciting to me to see that we're at this place, and even being here at CSW and having all the work that's being done from our professional associations nationally and provincially.
So this is a great segue as we talk about guidelines, hopes, and dreams into the report that I want to just talk about very briefly, because we talk about, there's current benefits, but as a system continues to evolve, there's also some challenges. And I think you've all kind of alluded to some of those challenges. The social work and primary care vision report is really, it was a document that was kind of created to kind of address some of the things that you guys have highlighted, some of the challenges that you have highlighted. And through Rochelle's leadership, a group of social workers across Canada came together to kind of talk about, well, what's a cohesive national vision, right? That could provide some guidance on what the role of social work can look like, what it should look like, especially within primary care settings. And in collaboration with the Canadian Association of Social Workers, the College of Family Physicians of Canada, the Foundation of Advancing Family Medicine, the Canadian Health Workforce Network, social workers from diverse communities across the country, and the University of Toronto responded to the call for that national leadership. And together, that group co-created a vision statement and policy brief that really aims, I think, to unify and strengthen the profession's contribution to primary care across Canada. So I'll just speak really highly to some of the recommendations. Here's what the future for social work could look like in primary care. So I think the next slide. So the idea here is that everyone in Canada has access to social workers in primary care, right? So making sure that anyone who interfaces with primary care gets equitable, timely, holistic support for their individual needs and family needs and community needs. There's also conversations about social workers, being involved and represented on decision-making bodies with respect to health. We do have psychosocial and social determinants of health expertise that I think can inform policies, funding models, system-level planning. We want to see more social workers involved in those conversations. The issue around pay equity for social workers across sectors, right? Recognizing the value of our contributions and supporting workforce sustainability as well. We talk about the clarity about client ratios. I think, Rochelle, you just talked about that for social workers in primary care. So, this entails being able to look at what's a manageable caseload, right? How do we reduce burnout? How do we maintain high standards of care, right, with the volumes that we see, right? So these are conversations that we need to have. The other piece as well is, how are we informed in terms of what informs our practice? What data informs our practice? So data on social work in primary care is critical, right? Because it enables evidence-informed decision-making, advocacy, and also contributes to continuous improvement. And I know that when I was in healthcare, when I worked in leadership, data was always an issue, not just for the health organization, but for social workers in particular. We talk about enhancing leadership opportunities. How do we create pathways for social workers to lead, not just informally, but formally as well? Social workers are innovators. We are integrators, right? We have a systems perspective. How do we contribute to the system in order to create more of that integration? Louis-Francois, you talked about this idea that, maybe I can write a letter for the client instead of always having the doctor write it, because it may be more efficient, it's more timely. So, as we start to think about all of those areas that we can potentially contribute, right? I think, Casey, you talked about the fact that, the world is kind of our oyster, right? It's not as restrictive as we think it is. So what does a scope of practice look like for a social worker if we worked to our full scope? Is it clearly defined right now? Are we respected for what we do? How do we optimize to allow social workers to practice to their full scope? And then I think last but not least is this idea of celebrating social workers' significant contributions to primary care, right? So how do we celebrate, not just advocate, but celebrate the contributions that we are making and that we want to make, right? By raising awareness, sharing success stories, embedding recognition into the health system culture, right? We have so many success stories. One of the things I always tell my students is, I say, be prepared. When the healthcare team doesn't know what to do, they're going to come and ask a social worker. That's usually just how it is, right? So these are some of the vision statements, the I guess guiding principles that we're looking to kind of unify some of the conversations that we're having. And so I'll put it out to you guys, because I think I've kind of talked enough. When you guys look at these recommendations, how do you see them applying to your local context? Are these relevant for you? And if they are, which ones are more relevant to you? Because they don't all have to be relevant to your context.
Yeah, I'm happy to start, because I think in terms of Ontario, I think all of these apply in Ontario. And because we have so many variations of models that have emerged over multiple different periods of time, starting in the 70s and early 2000s and onward, there's vast variations of caseloads that social workers have. There's different types of structures that social workers are working in. There's different roles. And so we know that there are some people who are working with really, really high caseloads and who are struggling and are feeling isolated. We know that from the research. And we know that in other teams that they have built in different supports. So the range of what practice looks like is variable. We do need a comprehensive workforce study in this sector in primary care, and probably I would suspect that CSW would say across all sectors, but in primary care, we need a comprehensive workforce study to understand what that looks like coherently, so we can advocate and make some recommendations and try to advocate for better structures and organizations. And then also second, to be able to predict what our workforce needs are into the future. You hear in the media all the time that nurses are predicting a shortage of XX workers in 10 years in primary care, or family physicians are predicting XX shortage in 10 years. Occupational therapists are predicting. We are unable to predict because we don't have absolute numbers. So be able to have a comprehensive workforce study across all provinces and territories in primary care would enable us to better plan, contribute, help respond to some of those gaps and isolations that we're seeing.
That's a really interesting point, especially given the importance of the social determinants of health right now, right? Even more prominent, has always been important, but I think there's an awareness of how important they are to the health status of the population. Louis-François, Casey?
If I could build on that, I think when we saw primary care rolling out in British Columbia 5-6 years ago, I think there was an expectation perhaps from physicians and nurse practitioners that social workers would be able to see similar numbers of patients in a day that they do. So, upwards of 20 to 30 people a day. And social workers were pushing back at the local level and at the managerial level, saying, well, no, that's not how social workers operate. And so just referencing the UBC Innovation Support Unit that I mentioned earlier, they did do some research into the number of patients or clients that a social worker might be able to see in a day. And it turns out the average is about 4. And so being able to demonstrate that to the Ministry of Health and to associations of family physicians to say, if you want us to see those numbers, we actually just need more social workers. We need more funding for more social workers to really hit that large number of referrals that we're getting, and to reduce the high caseloads and what we're seeing is some burnout in some primary care networks.
Yeah. There's a question here that I want to bring the audience in as much as possible. One of the questions here is, what would defining scope of practice look like? This is becoming a huge concern from my practice experience and perspective.
I think it's becoming a huge concern for many social workers across Canada, because I think that there's this logistic of, we have to think about getting access to services, and access is numbers, right?
Right.
But it's a trap. I think that this way of thinking is a trap, because so much of what I do on a day-to-day basis cannot be, numbered, for lack of a better English word. You were mentioning, Keith, about how, you want something to get done, you're not sure about something, go see the social worker. So much of my day has to do with that, with the knock-knocks. Knock this, knock that. Do you have a minute for me? So much of our work in primary care has to do with that. And I'd be hard-pressed to describe a way of, producing, enough data to justify our presence in primary care. But I think that numbers are not the only way to go. I think that there has to be a qualitative description of what it is that we do, because there is this danger of social workers in primary care being defined by the number of people that they're seeing a day, like Casey was saying previously.
I think another piece. Were you going to say something, Rochelle? Sorry.
Yeah, I just want to show one slide. This slide, we did a scoping review to understand what was social work's scope of practice in primary care. And what we're seeing is largely the social work scope of practice is, and although it's not depicted on this slide, it's really, around the mental health. We're seeing social workers as counselors, mental health counselors, as in Ontario and elsewhere, as one of their key roles. Case management is another kind of key role, system navigation, as well as on the right-hand side, you'll see the range of different direct patient care types of activities that I think Casey had mentioned in his role. And so we're seeing that there's like this broad range. And so scope of practice, we do need some guidelines to advocate to primary care leaders of what that scope of practice should be. But like I had said, right now we're seeing, like, sometimes people say like mental health psychotherapists, but mental health counselors, therapists tend to be like one of the core roles that we're seeing in primary care.
I also have some people talking about, the cultural perspective around educating more First Nation students and how that also is contributing to a beautiful shift within the system. So we literally have 5 minutes, and so there's some amazing comments coming out in the chat. Amazing questions, and I feel like we can have these questions for the next hour. We've literally just scratched the surface, and it's so frustrating to kind of leave the conversation here. But I think the idea was to spark the conversation, spark curiosity, and spark some ideas. And this report is really important and can be used as well as a tool within your own local settings to kind of advance the work. So we're really grateful to the Canadian Association of Social Workers, who will be using the report as a key resource to highlight and amplify the contributions of the social profession throughout their national level advocacy, their policy development, and also anything that they contribute to the system's transformation work. And we really hope that by integrating the report's findings and vision into broader initiatives, that CASW will elevate the visibility of social workers in primary care and ensure that our role is recognized and supported within Canada's evolving health landscape. For those seeking more information and knowledge, we've developed a series of primary care social work modules as well, designed for social workers currently working in or interested in expanding their knowledge of social work in primary care settings. The modules, I believe, are available through the CASW website. You can, I think there's a link. And it really offers a wealth of valuable insights, including practical knowledge, evidence-informed practices, and I think some really compelling stories from practitioners across the country who are making a difference in primary care. So whether you're new to the field or looking to deepen your expertise, we think that these modules will serve as a rich learning resource. Any last minute, we have 3 minutes. I'm giving each of you one last minute pearl that you want to leave with our audience today.
Maybe I'll just mention, as a qualitative researcher, I have the luxury of being able to travel around and talk to providers, talk to patients, and I know how monumental and significant and important kind of contributions that social workers add to people's lives. And I hear this all the time. So I don't know if it's like pearl of wisdom, but just want to reify how important this contribution is in primary care, because it is really making contributions in people's lives and communities.
I just want to say thanks to the University of Toronto for doing this research and putting this together. And I'm really excited to see that other faculties of social work across Canada are starting to take up primary care as part of their curriculum. My hope is that this will be a core component of any BSW in the future.
I'm going to close by saying that we have a very interesting question that was sent to us, and that says, how can I help further this conversation and contribute to system level change? What a great question, and we would need an additional hour to answer it properly, but I'm going to give it a typical social worker answer and say network with other social workers in primary care. Find a way to make your presence known, find a way to make your professional reality be known to the government, to the the deciders, but I think that this conversation has to start amongst ourselves first and foremost.
And I would also say kind of stay tuned, because I know the CSW has some future plans. I know that some of the provincial associations have some plans to help mobilize social workers and some of this social workers in primary care. And so, wherever there's opportunities in your provincial associations or any of the work, we're always happy to have conversations with anybody in primary care, but really tap into what's happening locally.
Okay, that's it, folks. As a moderator, I'm going to bring this to a close. People need to get back to their lives. Thank you so much, Rochelle, Louis-Francois, and Casey. We are looking forward to more conversation. Thank you so much, everyone, and all of the social work community who is out there looking to do this amazing work and getting more information. We will continue the fight. We will continue growing. Thank you for joining us. Have a good day. Bye-bye.
Thank you, everyone. Thank you.